People have asked me, well, how did you end up in Maine? You know, Rhode Island, Massachusetts, your nearby neighbors, but how'd you end up in Maine?
Fellowship had worked with the Department of Mental Health. There was at the time a need to expand more residential programs in the state.
They were putting some RFPs out for a new type of program, and the program was to serve people that had neurocognitive behavioral disorders. We were told that the people who were being referred to us had very little likelihood of success because of their years of living in a state hospital, and for the majority of those folks, they never went back.
Our programs in Maine consist of two residential facilities. One is located on Ralph Street and the other in Broadway.
The Ralph Street program opened up in 1999 and serves 6 individuals with severe and persistent mental illness and neurocognitive issues.
Ralph Street is an interesting house. It's got cathedral ceiling, and it just has its own charm.
Broadway, which opened in 2001, also serves individuals with severe and persistent mental illness and neurocognitive issues. Broadway
is a delightful house. From the outside, it has the appearance of a bed and breakfast. It's a big house. It's a charming house. There's a lot of character to it.
The homes really do feel like homes and not just residential programs. And that's a credit to the day-to-day staff and the relationships and that they've developed, the rapport they've developed with the residents over the time that they've been here.
When I think about Maine, the first thing I think about in our programs there are our staff. The leadership, not only at the regional level, but at the programmatic level, is probably the best that it has ever been.
What Brent brings to the position is that he has a good understanding of the administrative side of it.
He's done a wonderful job. In fact, I think that the faith that the Department of Mental Health has in us at this point in time in discussions about expansion is directly attributed to his leadership in the region.
The strengths of the staff is amazing. They genuinely care for the individuals, and it shows in everything they do.
When you walk in the door at Broadway or at Ralph Street at any time of day or night, you will see staff engaging with residents regularly.
You'd probably have a hard time telling who's the staff and who's the resident.
There's a real sense of camaraderie and teamwork.
I've never had a group of staff that are this caring about the clients that we serve. It's amazing.
You feel like you're family here, whether you're staff or whether you're a consumer. It's just a family. It's like coming home to work every day.
Ralph Street program has almost all of their residents are either working or volunteering, and the vocational persons with them. We have several here at Broadway that are either working or volunteering.
We have some volunteering at local music stores or library. We have someone that works at a thrift store.
We do a variety of things. We listen to music, or we do arts and crafts. We do cooking every week. We make homemade dog biscuits, all natural ingredients. And we make them in the morning, and then in the afternoon we deliver them to the dogs at the Bangor Humane Society.
Our main programs are primarily residential at the current time. However, we're looking to expand on our services to provide community-based services.
Over the next 20 years, there's a lot of growth potential within the state of Maine for fellowship.
You know, my one disappointment is I haven't seen Stephen King yet. His house is probably 5 minutes from Broadway.
The future looks bright in Maine. We're looking at growth. We're looking to sustain what we have and build upon that.